So now let's talk about precautions. Precautions are conditions that should make you think twice before applying K-tape. For those of you with a medical or healthcare background, this is the time where you can use your clinical judgment to decide if the person you're applying tape to is a good candidate or not. For those of you who do not have a medical or healthcare background, I would consider all these precautions as additional contraindications, meaning times you just should not even apply K-tape. Okay, so now let's get into each one of these one by one. The first one is active cancer. You should not apply K-tape to somebody with active cancer because you never want to do anything that could potentially contribute to the spread of the cancer. However, there are many patients that are currently receiving palliative care, and in that instance, it may be okay to apply K-tape. Now, I say may be okay because this is definitely something that you want to do with the informed consent of the treating physician or the oncologist or whoever is directly supervising their medical care. The second one is kidney disease. Because the kidneys are responsible for a lot of the filtering of all of our fluids and have a direct effect on the amount of fluid in our body and our circulation, obviously K-tape, whose main purpose is circulation, can have an effect on that as well. And if kidneys are struggling or if they're unable to keep up with the additional circulation that K-tape can create, then it's not the best idea to apply K-tape to somebody with kidney disease. I've heard, and there's obviously mixed guidelines on a lot of these, but I've heard that somebody with chronic kidney disease stage 3 or 4 is a contraindication and stage 1 or 2 is more of a precaution. Again, if you don't know anything about this stuff, just err on the side of caution and don't apply K-tape to anybody with kidney disease. The third one is advanced heart disease. For similar reasons, the heart is also responsible for circulation and moving fluid around in our body. And if we're circulating or if we're creating more fluid and forcing the heart to kind of do more with this fluid, it can stress the heart. And if somebody is experiencing heart disease and already has difficulty with the circulation and keeping up with fluids, we don't want to add to that workload. So do not apply K-tape to somebody with advanced heart disease. And then if you have the healthcare background, use your clinical judgment for somebody with mild or moderate heart disease. Vascular issues, again, more circulation. So I would definitely not apply this on a region where there's obvious signs of vascular issues. So this would be, a place with many varicose veins or hemosiderin staining. And if these are unfamiliar terms, just stay away from vascular issues. If you're a practicing clinician, use your judgment. If the vascular issues don't appear to be systemic, you may be okay applying it in a region that doesn't appear to be directly compromised by vascular issues. But again, if you are unfamiliar with this, just don't apply it at all. And then the last one is decreased sensation. And we say this because if somebody has decreased sensation and we apply K-tape and something is happening as a result of the K-tape, that person would probably not feel the issue that's happening. And that issue could be shearing of the skin, or irritation, or rash, or some sort of ulcer that develops, or they may forget that they even have it and then they leave it on for too long and something happens, or it gets dirty, or we create an infection. So if somebody has decreased sensation, I would not apply that to that area unless, again, they have somebody else who is a caretaker or somebody who can monitor them, or you're somebody who monitors this part that you're applying the K-tape to. But otherwise, we don't want to do it on somebody with decreased sensation.